Thank you very much. My name is Loren Schechter. I'm a plastic surgeon here at Rush University in Chicago, and I'm the director of gender affirmation surgery. I've been performing surgery, gender affirming surgery, for over 25 years. My exposure and experience really started as a resident. That was my first exposure to the field. And that was really in the early to mid 1990s. And what was very striking at the time were the barriers for people trying to access medically necessary care. At that time, insurance didn't cover procedures. People had to go to extreme lengths, mortgaging their homes to pay for this medically necessary care. It was always unconscionable to me that people had to leave the States, had to travel abroad to access medically necessary health care. So no insurance coverage, limited number of surgeons and healthcare professionals who were trained and willing to care for people who needed help. Hospitals that wouldn't allow you to perform the surgery. And that was my early exposure, and recognized the need that we're here as physicians to help people. And so my exposure really goes back to the early to mid 90s when I finished training and started in practice in 2000 and was performing surgery. Some colleagues, healthcare professionals from where I trained, asked me if I wanted to continue doing the work, and I said yes, and would continue doing the surgery, just part of my overall practice in plastic surgery. Again, many challenges, many barriers to care for people, which was really very, very striking. I would say probably 12, 13, maybe 14 years ago, the environment started to change. Society started to change. I think there was a confluence of events. You had the internet, which brought people together. Prior to that, I think people were very isolated. People felt alone. They didn't realize there were other people who had similar experiences as they did. There were often very small community gatherings throughout the U.S. where people would host social events. They would ask or invite some physicians to attend to talk about hormones, talk about surgery. And I think one of the positive things about the internet is it did bring people together. People were able to access and recognize that there are many other people who had similar experiences. So I think that was one thing. I think changes in insurance began to open access to care, to facilitate access to care. Hospitals, which hadn't always been the most welcoming environment for people, I think also began to recognize that they needed to change. And so this confluence of events, we did see an increase in the number of people requesting surgical services. And with that, my practice in the area has grown, and it's now what I really specialize in doing. So it's been a very rewarding career for me over the now almost 24 years in practice. It's been a real evolution. Watching changes in society, changes in healthcare delivery, watching people have access to care. Traditionally, many transgender people were denied access to medically necessary care, and so shifts in societal attitudes, changes in insurance coverage, changes in hospital and medical center policies, creating a much more welcoming and open environment that allow people to not only live their authentic lives, but to be in a welcoming and safe environment. Surgery is a stressful period for anyone undergoing a procedure. That's obviously a physical stress, it can be an emotional stress, it can be a financial stress. And, when added on that, discrimination, stigmatization were really added challenges that many people faced. And so it's nice to see, over the course of the last two and a half decades, how that has really that's really changed. Now we're facing, again, challenging times. I think one of the biggest barriers to care or threats that we see are misinformation and legislative efforts or policies that are really based on incomplete or misinformation. And part of what I've tried to do in my career is help people to understand that we're providing medically necessary care for people, and that this is just one component of healthcare. And healthcare is between the patient and their professional, between the patient and their physician, and so I'm hopeful that through these efforts that we'll be able to address some of the misinformation and help to educate patients and the public as to the importance of safe, accessible, medically necessary care within the transgender healthcare umbrella. Yeah, I think one of the, again, historic challenges we saw was lack of education in medical schools, residencies, and so that's changing for the better. Education in medical school has improved. Education in residency has expanded. So the healthcare system, so to speak, producing more people who are trained to deliver culturally competent healthcare, attentive to needs of transgender individuals, I think has been another major advance in the field that we've seen over the last probably decade or so. I think it's important for surgeons, for plastic surgeons, for other surgeons who are interested in incorporating gender-affirming care to get the appropriate training and education, and that comes in various different forms. It also depends on the types of procedures that the surgeon wants to offer. Breast procedures, chest procedures, facial procedures, many are within the standard practice of plastic surgery, but some of the more complex genital procedures or genitourinary procedures really require some additional training and experience in that field. So there are a number of fellowships. We have the oldest in the States in gender-affirming care, started back in 2017. So there are opportunities to do formal educational fellowships, training programs. There are any number of educational seminars throughout the course of the year by a variety of professional organizations. Those are things that didn't exist even a decade ago, and so one of the other major advances has been the expansion of continuing education offerings, courses, didactics focused on gender-affirming surgery and transgender healthcare. So I think getting educated, getting informed, working with another senior, more experienced surgeon, whether it's a formal fellowship or observership, I think are ways to begin incorporating this in your practice.